Patellofemoral pain syndrome causes pain in the front of the knee behind the kneecap. It often starts out as an ache in the knee when sitting around, and it usually gets worse with exercise. If it gets out of control, it can lead to constant pain at rest, and of course it'll get worse after doing any sort of physical activity. Most people with patellofemoral pain syndrome aren't ready to go to the doctor yet, and they're looking for ways to figure out if they've got it at home because they don't want to go get an x-ray and have to take time out of the day to go see the doctor. So in this video, I'm going to show you 3 quick tests that you can do right now to see if you have patellofemoral pain syndrome. And if that's not what's going on, I'll also talk about what else it could be. Now, these tests are supposed to cause a little bit of pain, so that's how you have to test the patellofemoral pain problem. So be careful with proceeding with these tests. In fact, you might watch this whole video before you go into it, and some of these tests you might already know they're going to hurt you without you even having to do the test. I'm also presenting these tests from easiest to most intense. So if you have pain on the first test or the second test, don't proceed into the next test because it's probably going to become more painful the further you go. Now I'm going to show you the test in just a moment, but just to understand the anatomy so you know why these tests work, is the kneecap right here is the patella, and it sits on the end of your thigh bone. Now on the skeleton here, it's attached with a wire, but normally the kneecap is floating in tendon of the quad tendon right here, the muscles that are on the front of the thigh. They form the quad tendon at the bottom here. It connects to the kneecap, and then there's another tendon or ligament that connects from the bottom of the kneecap to the shin bone right here on the bump. Now the kneecap slides up and down on that groove on the thigh bone right here, and it doesn't really ever connect or touch. It connects, but it doesn't touch the shin bone directly. It just slides in this space right up here. So understanding that, the first test to check for patellofemoral pain syndrome is a quad contraction test. Now those quads are the muscles on the front of your thigh. So what you've got to do for this test, it's the lightest test. If you think of your thigh muscles right here, you're just tightening them up as much as you can. Do it gradually so that you don't set off pain all of a sudden. But if you can begin to tighten up that quad all the way, it's going to pull the kneecap up and towards your thigh bone. And if it hurts to do that, then you have irritated tissue behind the kneecap, and that would be what we call a positive test, and it's a sign that you have a patellofemoral pain problem. Now you are looking for pain right behind the kneecap. That's where you would expect to have it. If you have pain somewhere else, like in your hip, behind the knee, on the inside or the outside of the knee, or somewhere in the thigh muscle up here, then it's not patellofemoral pain syndrome. It's probably something else. Now the second test is a full knee bending test. Now the theory behind this one is, of course, your quads run in the front of your thigh and connect to your kneecap here. And so when you bend your knee all the way like this is the test. You're just pulling your knee up towards your chest and getting it to bend its full range of motion. You're stretching all the tissue, all the muscle here, the tendon, and you're pushing the kneecap against the thigh bone. So when you bend the joint all the way, this tightens up and it compresses the kneecap into the thigh bone. And if that kneecap back there, the cartilage behind it, is irritated, then you're going to compress it and it's going to aggravate it. Very much like if you had a bruise on your skin or a cut, if your skin was injured somehow and you press it, it's going to hurt. That's kind of what you're testing for here. You're bending it to compress the joints, and if it hurts, then you probably have a patellofemoral pain problem. It's got to hurt right behind the kneecap, though, in order for you to count this test. Now, the third most aggressive test is a kneecap compression test. In the research, they call this Clark's test. Now, I've modified it to make it less aggressive, but it's already kind of aggressive. You have to sit somewhere where your leg is supported like this. So up on a chair, or find somewhere where you can rest your leg like this. You could technically do this with your foot on the floor, just with your legs straight. Then what you're going to do is gradually apply pressure onto your kneecap. So my kneecap's right here. So I'm going to put my palm over the kneecap and begin to push gradually down against my leg. If it begins to hurt right behind the kneecap right there, you've got an irritated cartilage behind your kneecap. You have patellofemoral pain problems. Now, if you did all three of those tests and they all bothered you, you can have pretty darn good certainty that you have patellofemoral pain syndrome, even if you've never been to the doctor before. So let me tell you what these tests do and don't tell you. All these tests tell you is that the cartilage behind your kneecap, right in here. And it could also be the cartilage on the end of the thigh bone. You really don't have 100% certainty if it's the thigh bone or the kneecap. And it's not really a big difference anyway, because it's a problem in the same area and they have the same root problem. All the tests are telling you is that that tissue in there is irritated. That's it. You don't know why at this point. You don't know what's causing it. All you know is that it is irritated back there, and that is why you hurt. That's why you would do these tests. If you did these tests and it didn't really set off the pain like I described, then it's probably something else, and I'll speak more about what else it could be here in just a moment. Let me tell you a few more points though. What these tests don't tell you is the root problem. What caused the patellofemoral pain syndrome? Because this is not a normal thing that people are supposed to get when they hit a certain age. This usually affects people in their 20s or 30s. It can even affect teenagers that are very active, especially those that are doing running sports like soccer, basketball, and football. And of course, runners of all ages run into this kind of problem at some point or another. Now, the root problem that I typically see that causes patellofemoral pain syndrome is that the quad muscles in the front of the thigh are over-dominant, they're overdeveloped, and they're compressing the kneecap against the thigh bone too much and rubbing the kneecap against the thigh bone excessively. That causes irritation either on the cartilage behind the kneecap or on the thigh bone. We don't really know 100%. But either way, that's what's causing the problem. Now, what mainstream medicine says is the cause for patellofemoral pain syndrome is they talk about patellar tracking, which I agree with to a degree. There's parts of it that I think are true, they make sense, and there's other parts that are not. Now, the patellar tracking idea, because if you've been researching patellofemoral pain syndrome, you probably found ideas or thoughts, you found something about patellar tracking. If you look at the kneecap right here, let me zoom in here a bit. It's got a bump right here on the bottom of the kneecap that sits in the groove of the thigh bone right here. There's two ridges or bumps on the thigh bone, and that kneecap just nestles or sits in there nicely. And so when it slides back and forth, there's supposed to be an appropriate tracking. And what's discussed as the problem is when the track is off. They call it the track and the train. So the kneecap's the train and the the thigh bone right here, the femur is the track. And if the patella's not sitting in the groove properly and it's moving inappropriately like that, then it's going to rub inappropriately and begin to irritate the cartilage either here on the kneecap or here on the thigh bone. Now, I agree that patellar tracking is an issue. The patella should move in a certain way on the kneecap, on the thigh bone, but the reason for it is not 100% clear in the medical research. Now, the medical community largely focuses on correcting patellar tracking by working on quad muscles. So the idea is that they think that if the kneecap is moving this way on the thigh bone, that you need to get muscles stronger on the quads out here to pull the kneecap over, or vice versa. They say the kneecap's too far out. That's the more common presentation. And so then they're saying that the quad muscles on the inner part of the knee are weaker and you need to pull that inwards that way. Now, this is wrong thinking. I disagree with that part 100%, because what is forgotten in that thinking is, what about the track? What about the thigh bone? Like, you're just trying to move the kneecap over with the influence of the muscles from the quads up here. But if you think of the thigh bone here, it has the ability to rotate. So if the kneecap is still like that and you can get the thigh bone to be in a better position for the kneecap, then you have a much better shot at improving your patellofemoral pain syndrome for the long term. So in order to fix the position of the thigh bone, you have to go up into the hip and down into the foot to see what influences those are causing at the knee joints. I hope that makes sense. I'm going to explain more about that. I've got a series of patellofemoral pain videos coming out right now, so I'll dive deeper into it. Let me go into next what the doctor is going to tell you. If you go to the doctor's office with your patellofemoral pain syndrome problem, they're going to look at you, hear your symptoms. You're going to tell them, yeah, it gets worse with activity, kind of aches and throbs when I'm sitting still, sometimes hurts at night. Sometimes it feels better when I start to exercise and move, but then it hurts worse later on. That's like the classic presentation for patellofemoral pain syndrome. So your doctor will recommend you get an x-ray, and what they're going to look at is the space between your kneecap and your thigh bones. They're going to do an x-ray with your knee bent where they're looking right here because they're interested in how much space is there right there, because if the space is decreased or if the patella looks like it's off the track, then they're going to start to make recommendations to try to improve that. And like I said, I wouldn't trust the recommendations, or I would take them with a big grain of salt and make sure that they're coming from a logical place when it comes to this stuff. Now they're going to offer you pain medication. The standard first treatment, pain medication, maybe a steroid pack by mouth to bring the inflammation down, and of course relieve the pain. And then they're going to tell you to wait 4 to 6 or 8 weeks and rest it. Don't do that activity. Don't run. Don't do sports. Get off your legs for a while so that you can rest the cartilage, and that's going to definitely make it calm down. That works for a lot of people because you're just not irritating it. Just like if you had a bruise, if you keep poking it, the bruise stays bad. It can even get worse, but if you leave it alone, it gets better. Now, if that doesn't work, if the 4 to 8 weeks go by, you go back to the doctor and you tell them, you know what, it hurts again, then they're going to offer an injection or possibly refer you to a surgeon if the problem continues to persist over time. Especially if you're the person that comes in every 6 months, every 3 to 6 months, you get better, you do good with the medications, maybe you have an injection and you improve, you get back to physical activity, and then it comes on again. And that just cycles over and over. People go years like that. That's when they get referred to a surgeon to look at possibly doing a surgical repositioning of the kneecap to align it better, which I think is a bad idea because we got to look at how that thigh bone moves first and muscles up in the hip area. Now, that root problem that I'm referring to of looking at the hip and the foot, I've got a program. Just want to make you aware. I've got a program called the 28-Day Knee Health and Wellness Boost Program that's designed to fix the common muscle imbalances that set up patellofemoral pain syndrome and a bunch of other problems too that affect the knee joints. It is heavily focused on getting stronger glutes as well as foot muscles so that your knee joint, the pressure around your knee joint is reduced so that the cartilage can be as healthy as possible for the long term. This really is a long-term solution. And the program is designed so that you can walk through it step by step. You can scale down the exercises so they're not as challenging for you if you're especially flared up in your knee joints. And you can do the program over and over again. You don't have to, it's 28 days, but once the 28 days ends, you still have access to it and you can repeat it and get even more improvement each time you go through it. Now, some other questions I get about patellofemoral pain syndrome are, what's the difference between patellofemoral pain syndrome and chondromalacia patella and runner's knee? And truthfully, they're all about the same. They're just looking at it from different perspectives. Chondromalacia patella just means that the cartilage behind the kneecap is thinning out or shrinking. Chondro means cartilage, malacia means thinning or shrinking, and patella is referring to the bone. So thinning, shrinking, cartilage behind this kneecap bone. Runner's knee is just, the reason they call it runner's knee is because runners often get this problem because they tend to be very quad dominant if they're not conscious about getting their muscles in balance, and this issue begins to affect them. So we see this in runners all the time. That's why there's that diagnosis of runner's knee. Now, what if these tests didn't work for you? Like none of them were painful for you. You felt fine with all that, but you still have pain in the front of the knee. What else could it be? There's a possibility you might have a meniscus injury. The meniscus is a big chunk of cartilage that goes right here where I'm sticking my finger between the thigh bone and between the thigh bone and the shin bone. You could also have a nerve problem in the area. There's nerves that are in the knee and around the knee, and if those are irritated, it's usually associated with pain up the thigh or into the lower leg as well. But that could mask as pain in the front of the knee too. You could have a ligament problem like an ACL injury, and there's also a fat pad. And even if you're a thin person, everyone has a fat pad that's kind of right here below the kneecap in front of the knee joint. It's on the front side of the knee, and in some cases that can get irritated and cause swelling in the area, and it can be painful just sitting at rest and doing very simple activities throughout the day without anything aggressive or any sort of exercise. But exercise will definitely set it off worse. I've got links to playlists for most of those conditions down in the description below, as well as a link to find out more about the 28-day knee health and wellness boost program. I hope you enjoyed this video. Give us a thumbs up and please share it with somebody who needs to see it. Thanks. Bye-bye.